deep breath in. Head back, exhale. Deep breath in. Exhale. Deep breath in. Exhale. Your side facing me.
Got lipstick on your shirt. Sorry.
Bottom leg straight, top leg straight. Deep breath in. Exhale. Side for me. Top leg straight. Breathe in deep. Exhale. Let's go face up. There we go. Okay. There we go. Good. A little bit of glue right up here, just a little tight. Here at the top. Shouldn't be any knots in the upper neck. It's supposed to be real smooth up here. Sort of the main engine of the neck is the upper neck. It's designed to work first. So if this part of the neck is stiff, the lower neck gets overexerted. So we sort of check the main engines, see if they're functioning properly. If they're functioning properly, then you know that the other parts of the spine aren't going to be overworked. About 60% of the work of your neck is designed to happen from the top first and the bottom last, and so you shouldn't be able to wear out the lower neck without the upper neck first wearing out. More on this side right there.
It's my bad side.
Good, that's it for me.
Sorry.
Come on this side.
Yeah, I see the back. Oh.
It's never normal to have the mark. The mark is always a result of lactic acid, toxins, adhesions. The body is supposed to be self-cleaning. When the head goes forward, the muscles in the back of your neck get tighter, and that's what sort of chokes itself off. It becomes so tight that blood has a hard time getting into and out of the area. So that's what allows all this lactic acid. Lactic acid is cellular exhaust. It's sort of the waste product of breaking down sugar, pyruvate. Your body breaks down sugar into pyruvate, and then that pyruvate runs through a cycle. You create ATP. As that ATP is expended, lactic acid is the waste product. The whole purpose of breathing is to bring oxygen into the tissue to bind to lactic acid to form carbon dioxide and water. So when the area gets so tight, it doesn't have good blood flow, the oxygen can't get into the tissue, the lactic acid stays in the tissue, and so that's what you feel. Is it feels, sore or achy or bruised. Nothing should feel bruised, nothing should feel sore. You should be able to comb the tissue and it just becomes pink. Whenever you see that dark reddening, that's the exhaust it's been trapped in there. So the pelvic piece is raised up a little bit. That allows there to be some space for the abdomen, gives space for the baby in there. The middle back area is one of the stiffest areas. Part of it's the brassiere that binds up the middle back. So keeping this area loose takes pressure off the lower back. Breathe, breathe. Body's first response to an injury is quarantine or stiffness. Body tries to protect. It sort of expects that another injury is going to happen. So the body binds the area up, and when an area is real sore, you sort of can protect it yourself. So part of this is trying to unravel, loosen up the areas that are bound up, that are not moving. That takes the pressure off the areas that are overworking. Starting light and then going a little bit deeper, trying to untangle. There shouldn't be any soreness in here. There shouldn't be any bruising. No, I don't agree with, it's very common. Many people have soreness in their back, but it's not normal. The back shouldn't be sore. I think of it like car door dents at Publix parking lots. A lot of cars have dents on their doors, but it's not normal. The world sort of blurred those words. Common and normal become the same. It's common for cars to have door dents. It's not normal. It's common for people to have soreness in their back. It's not normal. Okay?
I'm not sore, don't worry.
Okay. Well, she's tough. She's been through this with years, but we got to get rid of all this. Just let that go there. Breathe, breathe. Try to keep your shoulder down. I know it's tough. These are the attachment points from the muscles in your neck, like the anchor point. So the farther forward your head goes, the more these attachments get pulled on. And there's a lot of different opinions on what to do about it. Some people want to inject muscle relaxants into them, or do trigger point work on them. We are trying to release some of the tension in here with the ultimate goal of trying to get the head back over the shoulders. The more forward the head goes, the constant pulling on here, and so you sort of can't ever ultimately relieve this by just doing deep tissue work. You have to follow it up with postural work. Chiropractic started in 1895. Until 1997, they were teaching that adjustments can change posture, that the chiropractor can push on your bones and that will change the position of your bones. It took until 1997 when they did enough research to show that adjustments don't change posture, massage doesn't change posture, electrical pads don't change posture, heating pad, it's all about stretching. Stretching is the only way to change the position of the body. And so the purpose of this table is to get your spine supple and loose, sort of like clay. You can't reshape hard clay. You've got to make the clay soft, and then once the clay is soft, you can reshape it. Like a piano, there's 77 keys on a piano. You can't tune a piano. We're not piano people.
I'm not very musical.
You can't tune a piano if you don't have all the keys working. So the first goal is to get all the piano keys moving up and down independently. 24 vertebrae in the spine. You want them all moving independently, all cleaning themselves by movement. if this part of your back is very stiff, if you have any injury, car accident or fall or anything happens, this part of your back, by it being so stiff, it doesn't really participate in the force of any injury. So you only get really injured in the areas that are functioning. You don't really get injured in the areas that are non-functioning. And so typically the lower back, lower neck are already the parts of the spine that are doing all the work pre-injury. They're injure those areas that are already doing all the work. So by getting this area working, we can take a lot of the burden and pressure off the lower back, lower neck. It's sort of an around approach. We work above and below the injured areas to take pressure off. If you injure an area, it will get swollen, and muscles will tighten to protect. A lot of people are, we got to get in there and release that tension. And I go, well, part of that tension is to protect the area that's injured. And the swelling is trying to, almost like a water balloon, is trying to, stiffen up the area of injury. And by further working on it, I believe you can potentially aggravate it more. So leave the injured area alone. Being pregnant, she's already got a lot of pressure on her lower back. I leave the lower back area alone, leave this alone. Get as much of the middle back working as possible. When you're pregnant, it's the best thing, even if you're not pregnant, but if you're pregnant especially, you have more weight to carry now, and the weight's in different positions than you're used to. So there's going to be different stress points, and you want to make sure the whole spine is functioning evenly. She's bulletproof. Needs to be able to. Pretty tough. But right there, it's a little tight. There'll be a mark right there. It's just feels like a little bit of glue. It just got to keep this area moving.
My shoulders are still sensitive right now.
Okay.
They're more sensitive than anything else right now. That part hurts.
There, it's getting red. It's a little darker here. Some older blood. These are more red. That's almost like a little bit of a darker color. It's a little more stagnant over there. It almost directly correlates with where the patient feels discomfort, where the mark will come out. If you don't feel soreness, and she felt a lot of soreness right here, and how quickly it comes out also signifies how much is in there. It took, a few swipes and it came out pretty dark really quick, and that shows you how much is in there. where she's pointing real quick came out.
Is it purple?
Mm.
It should be purple.
It shouldn't be purple.
It itches. So why does it itch, Doc?
It's toxins. Lactic acid is a toxin. It's technically a waste that has to
Feels
be
good to itch it.
brought out of the body. Trying to get oxygen in there. There we go.
Remember when you fixed my thumb? And like every other part of me?
How many years had you ridden horses before I met you?
Forever.
Forever. How many times you fallen off that horse?
Couldn't tell you.
Couldn't tell you.
Too many to count. Remember my first fall was when I fell. I was 8, I think, and I was drug. Is that a word? Drug? Not drugs, but the horse drug me. My foot got caught in the stirrup. And I just went for a little ride on the ground in the dirt. Until my foot popped out of the stirrup. That was my first fall. It was traumatic.
Alright, so we just loosen it up. I just want to see if there's a little bit more in there. See if there's any more. Relax your chin up. There we go, a piece. A little bit more. Bring your chin up a little bit. There you go, perfect. Nice. I'm working the back of the legs.
Oh, let's not do that. The back of the legs.
Alright, there we go. You okay?
Very good.
We gotta get this SI joint moving. What was your childhood injury?
It was my glute. So I fell off a tire swing in the 3rd grade and hit something hard. Like I flung off and it severed a muscle in my right glute. So the muscle, I used to call it the dent in my butt until I knew that it was actually a severed muscle. So yeah, that's what happened when I was a kid.
Any injury to this joint makes it want to stiffen up, and then the lower back takes the stress, so you want to keep this joint working as best as we can. Not the hamstrings. It's pretty tough. So the medial meniscus has most of the injury in the knee. About 99% injury to the cartilage in your knee is from the medial side. You know, they say it's age or weight, and I go, well, how old's the medial meniscus? And I have big people, small people with knee injuries, runners. You know, it's based on the alignment and mobility. And so if more your toes flare, the more pressure that goes on the inside of the knee. And so what we're trying to do is release some of the tightness on the inside. The vastus medialis muscle here gets really tight. It attaches here on the tibia. And so the tighter this muscle is, the more it squeezes the meniscus. Meniscus is made of 70%, 80% water. So the more that meniscus dries out, the less it functions in preventing the tibia and the femur from touching each other. So trying to unglue this.
This is how you get him away when it hurts.
Perfect up kick. Does she do UFC? After working on me, she does. All right, so for the knee stretch, we're gonna try to open up the knee, come down onto your knee, try to get your bottom to your heel contact, come up, down, up, down about 10 times to open up that medial meniscus. This stretches out the vastus medialis. Yep. Come up, down. But a set of 10 times.
Yeah, after we started working on this area and telling me to do this, the pain went away. So I just maintenance it now with stretching and having you come in. I even gouache on myself to clear out the tissue.
The other leg.
So. You can do it on the floor. I usually do it on the floor, right? Just
In yoga, there's fixed firm. You can do both
Yeah.
knees at the same time. You know, we can isolate one knee at a time. And there's 2 more modifications of this. The next modification is you take your leg, actually have the toes pointed, come down inside, come up, down inside. That's going to open up that meniscus, allow it to breathe. All right, very good.